Hi everybody and welcome to today's session. It's titled Towards Net Zero Healthcare Systems. I'm George Valiotis. I'm the Executive Director of the European Health Management Association and I'll be the moderator for today's session. I want to start by acknowledging Philips and the Partnership for Health System Sustainability and Resilience who've made today's session possible. And I also want to thank our panelists who are going to share their incredible expertise to help us further explore this session. Before I get to fully introducing them, I want to really just frame what the topic here is today. We're talking about the building more resilient, sustainable and effective healthcare systems. And why we're doing that is because we know that healthcare systems and the world is changing rapidly. We know that over the next couple of decades, we're going to see major changes in demographics, in technological development, in the environment, but also we've learned a lot about how to get better health, positive health outcomes. And in that way, as we move in that direction of providing healthcare in that setting, we also have to acknowledge the environment, and healthcare systems have to take accountability for our carbon footprint and for our waste. And so in this session, we want to explore how do we do that. What we also know is that in order to achieve that, we have to be working in co-production and working together. So in that spirit, I'm going to introduce a Slido poll that will come up on the screen. I would love to hear your views. So both whether you're online or here in person, you can take a snap of that and give us your one-word answers, 2, 3 words, whatever you're comfortable with, to help us understand what is the most critical barrier to environmental sustainability in healthcare. That'll help us set the scene to understand where are we starting now. And we'll see the answers start to come up. You can see some pointers there. Oh, right, it's a multiple choice, I see. So, lack of data and mechanisms to measure emissions. Everything's kind of on par. Missing policies and legislation, missing roadmaps and targets, lack of funding for infrastructure, research and development. But what's quickly taking the lead is missing policies. I feel like an auction. Is lack of data going to overtake it? Oh, they're on par. Right, so really it's a head-to-head of missing policies and legislation and lack of data. So let's jump into some of those further, but really all the other topics. And I'm going to hand over to our fantastic panelists. If you could just start so we can get to know you. I mean, you're already celebrities of healthcare already. I think we all know you from the different work. But tell us who you are in this context and why is this session important for you? Roberta, can I start with you?
My name is Roberta Lichtenecker. I'm an economist and head of Department Climate and Health at the Austrian National Public Health Institute, Gesundheit Österreich. And over the last 60 months, my team and I developed strategies and new and innovative projects to support the healthcare system and healthcare facilities to become sustainable and climate friendly.
Great, thanks for that great work and thanks for being here. Joseph.
Yes, hello. My name is Joseph Figueras, Director of the European Observatory on Health Systems and Policies. Why am I here? Because I think it's the hottest issue that we're addressing actually this year in Gastein and probably in the next few years. If you were in some of the sessions earlier, environment has been at the center, at the top of the priorities and the concerns. And I think what I find very exciting about this session is that it's not only the concept of the health benefits of the environment we are all clear about, but what's exciting, and if you allow, I'd like to develop that issue a bit more, is the idea of the environmental co-benefits of health and health systems. It's not only what you, environment, can do for me, health systems, what I can do for you. And I think there is this win-win. I think this element of making a case for strengthening the health systems and health as a key element also to strengthen the environment. And I think we're not getting that clear enough. I like to push this agenda or this thinking later on, if you allow me, George.
Please, we look forward to it. And Jan Willem. Oh, Aki, sorry.
Yeah, thank you. My name is Aki Haukilahti, and I'm representing the Tampere Heart Hospital Group, Finland. Greetings from Finland, everyone. I work as a VP in Heart Hospital, and why am I here? Well, beautiful Austria, I think that the place is really beautiful. But from the work perspective, in Heart Hospital, we have chosen sustainability as a core in our strategy in 2021. And we have worked for a few years now with that. It covers also the social, economical, and environmental aspects. But when it comes to environment, we have recognized that we can't solve this alone.
Thank you very much, Aki. Jan Willem.
Yeah, thanks. Jan Willem Schijgrond, I head up government affairs at Philips. I'm also an environmental engineer, so the first time we talked about climate change was 1989, I remember, when we were still having some climate deniers, but the science already said it then in 1989, that this was happening. Fast forward today, I'm still working on trying to decarbonize healthcare, and also with the Partnership for Health System Sustainability and Resilience, a partnership with the London School of Economics and the World Economic Forum. We believe that improving this resilience of healthcare systems and the financial sustainability can only be done if it's also environmentally sustainable.
Okay, so let's start practically then, because when we have a look at the Slido polls and the questions and the theory, nobody would disagree. No reasonable person would disagree. But practically, Aki, can I come to you? Like practically, what do we need to do in health systems and hospitals to actually achieve net zero?
Well, I can tell a few words from our journey in practice in Heart Hospital. So when we started in 2021 to look deeper the environmental side, we found that in public health there ain't actually legislation or policies, at least in Finland, regarding this. So we started to follow voluntarily the GRI standard and go with that. Companies go with that. So and then now we know there's the EU, so the European Sustainability Reporting Standard coming 25, mandatory for companies with 250 people. So most of the hospitals are bigger. So that's one thing. So there is no legislation, it's voluntary. And when it's voluntary, the system or the players in the system don't take it so seriously. All the players, there are responsible players, of course. And then another thing I think is when we deep dive together with Philips, Philips is a long-time partner with us. And then we had a small Finnish CO2 consultancy company. We deep dive into our numbers. So we quite soon figured out that we can improve in scope 1, scope 2. So what we do by ourselves, maybe to some extent in scope 3 when it comes to the downstream. So how we deliver the services. So we can take the digital services and this how decarbonize the delivery. But when we come to upstream, so there's the supply chain, and we use a whole lot of consumables, single-use devices, the logistics. Though we have made the contracts that would support the road traffic, most of the stuff and supplies, medicines come through air. So, and this is why we can't solve this by ourselves. So we need legislation, and we need policies, and then we need the cooperation with the industry and the players in the whole system.
Okay, so thanks for setting the scene about like practically what you need in order for hospitals to start to make these changes. Joseph, I want to turn to you. Like, is that the right focus? If we just keep doing that, is that enough? Or do we need to think broader than that?
Thank you. I'm sorry. Yes, no, I think it's extremely exciting. And if I was moderating, I would ask you as well the numbers and whether we can make it sustainable, as you will do in a minute, George. No, as I was trying to say, I mean, let me do a bit of a plug for the observatory. We have this work on making health for all policies. And in addition to decarbonizing, reducing the carbon footprint, I think if we're talking about resilient health systems, we need to talk as well, how do we respond to the impact of the environment? Heat waves, the way they affect our aging, the food instability, and water quality, and a number of infectious diseases. Vector-borne diseases, because of the environment, are changing entirely in sub-Saharan Africa, but they're affecting Europe as well. Obviously, the pollutants and what it means for asthma and cardiovascular diseases and pulmonary diseases. So, are we getting prepared to shape our health system to be more resilient? A project that we are doing for the European Commission with the OECD, we're looking at testing virtually the health system resilience to a number of shocks. And environment is one of those shocks. So the virus has been a good preparation, the COVID. So that's one aspect that we need to take into account as well. But the second that excites me is, of course, is the direct contribution to the greenhouse gases, but also indirectly take the role that the health system through their staff. And you are leading a project which we're very happy in the Observatory to be involved, Be Well, which teaches green skills. The health workforce can be a really active vector to influence the community, to influence policies. Health in all policies from the health sector. Diet. And you know, I'm looking at win-wins. I'm looking at those areas where actually a vegetarian diet is good for the environment, is good for health. A green spaces is good for the environment, is good for health. So it's these elements, because there are some other policies that are more difficult to defend, but those, actually I said earlier in another meeting today, but it was closed doors, that I was presenting that to a minister of health of a country whose name I forgot, and she was saying to me, wow, that's true. But how am I gonna talk to the meat industry so this is the political economy of it. But there's so many of these strategies. For instance, self-help. For instance, the communities, the patients sort of being more in control of their health actually ends up with better use of pharmaceuticals being one of the major areas, production of pharmaceuticals having a negative impact on the environment. I'll leave it here, but I'd like us to be a bit broader and look at that from a broader perspective.
Well, thanks for setting the broader scene. And what I'd like us to do throughout this session is then look, if those are some of the framings, what are the policy drivers? What are the financing mechanisms? How do we actually make these things happen? So if I was to look to you, Jan Willems, and ask you, what about the role of technology? What are the role of industry? What can we be doing to get to target to net zero through industry's contribution?
So if we look at the hospital itself, in general, just where scope 1, 2, and 3 is, about 70% of the impact of the health system is in the supply chain. 15% is energy, buildings, and 15% is transport and other indirect effects. So if you're looking at your hospital and you're trying to go to net zero, then of course you're going to look at your supply chain. And if we look in the hospital, technology is about 6% of the carbon footprint. So the radiology department and stuff like that. But why do we actually need to go to net zero in the healthcare system? 2 reasons. First of all, the healthcare system is the first sector that actually understands the impact of climate change. To Joseph's point, climate change gets a human face in the hospital. Right? That's where it's being felt. So it should be the canary in the mine saying something is wrong with the earth, my patients are getting sick because we're heating up. And that's why we should be the first sector to go carbon neutral. But then, of course, you need to know, if you're going carbon neutral faster than anybody else, and I think we should be going faster than mobility, faster than construction, faster than the energy sector, because we feel it first, we should lead by example. So if we go carbon neutral as the healthcare sector, you need to understand why. Hospitals have, on average, a carbon footprint which is 2.5 times higher than commercial buildings. So, okay, that's a lot. But then if you go into the hospital and you look at where the biggest hotspots are, it's the radiology department, it's the ICU, it's the operating theater, it's the cath labs, 60% higher carbon footprint than the rest of the hospital. So that's the message, that's where you have the chance to actually reduce your carbon footprint by just trying to improve your processes the way they are. But if you then start to disrupt the healthcare system and go to different delivery models, that's something that we're also investigating with the Program for Health System Sustainability and Resilience. You're starting to see, if you reorganize with AI in mind, for example, then you can actually completely radically reduce the carbon footprint of your healthcare system. The Lancet said AI holds the biggest promise for decarbonizing the healthcare system, but we don't know for sure. We don't have the evidence. So if I would say, where do we start on policy? Where is the evidence that we can actually reduce the carbon footprint of healthcare, reduce the cost of healthcare, improve the outcomes of healthcare, improve the patient and professional experience through AI and technology? we need to develop that roadmaps for decarbonizing the healthcare sector. Then you can look at 2 or 3 areas very specifically. Circular economy, we've been talking about it. It's really relevant in healthcare systems. We need to build more circular economy models and allow legislation for circular economy models to be introduced. Not everyone in Europe has that. And then we look at green public procurement. A lot of governments procure medical equipment, pharmaceuticals, consumables through pooled procurement, but they don't actually take into consideration the sustainability aspects. Why can't we green this procurement? According to the EU legislation, we can already allocate 15% of the scoring in a tender to sustainability performance. Let's upgrade those standards, let's make them real. And finally, as I said, digitization and AI, if it holds the biggest promise, investigate. And my gut feeling that it's going to radically transform healthcare needs to be proven, because everything we do in healthcare, also decarbonizing healthcare, got to be evidence-based.
Okay, so you've raised some really key issues there around the circular economy, around the evidence base, and certainly that's coming up as well in other comments like we've heard from Joseph. So I want to bookmark that, and we'll come back to that as we go into further questions. But I also want to say to the audience, both online and here in person, remember that you're moderating with me, and I want to really push you and provoke you to ask questions, to hold our speakers to account, and I'll come to them in really just a moment. So I'm going to remember that hand, and I want the rest of you to think about what else do you want to know? Where else do we want to dig deeper? What evidence are we looking for? Roberta, I'll come to you next, and I'm thinking about from the perspective of a public health institute, what other measures can be taken to make sure that we can achieve some of these ambitions?
We heard it today. It's a big challenge to become climate neutral and implementing the measures in the healthcare facilities. And becoming climate friendly and sustainable comes with a lot of benefits. Cost reduction, we heard it, for the healthcare facility, but also for the general public. Yes. Then the strengthening the image, yes, is an important thing. Also the creation of an environmental friendly and health promoting environment for patients, employees and visitors. And also the attractiveness for as employer, yes, will be a good thing with climate action. Yes, and however, in practice, there is often a lack of expertise, information, assistance, and support. Yes, to anchor the climate protection measures in the health facilities, and therefore we created 2 innovative projects. The first one is the climate-friendly healthcare facilities, and the second one is the climate manager training. And the first one, the climate-friendly healthcare facilities, the major goal is to support the healthcare facility, especially hospitals, to become climate-friendly and sustainable. And experts are providing, yes, the necessary expertise, guidance, and covering all action areas to develop a carbon neutral healthcare facility. And the action areas include buildings, mobility, energy, waste resource management, but also green space, food system, and procurement. That's a very important point. And the major advantage is that the healthcare facilities receive the expertise of one single source. And we presented the project last year in August, yes. And now are 320 healthcare facilities in Austria part of the project. And I'm happy that 77 hospitals are on board. And I'm delighted to share with you the huge success of our project, climate-friendly healthcare facilities. The climate ministry in Austria has allocated 350 million for the next years for investments in energy efficiency in hospitals and also in retirement homes and nursery facilities. Yes, and secondly, the climate manager training. We know the various professional groups in the healthcare sector are key players in implementing the measures, and these professions must be equipped with the necessary key competences and skills. And for this reason, we developed the Climate Manager training. And the course covers all action areas, you heard it, and considers the topic of climate change adaptation, climate change protection, and health promotion in an interconnected way. And furthermore, competencies in data collection, monitoring, also communication and just communication, the awareness, actions, and also project and process management are taught. And both projects, I think they are best practice in Europe.
Roberta, it sounds fantastic, and really congratulations of the great work of Austria. I'm bookmarking a few things. I want to come back to you about some of the leadership that we're seeing from Austria. But first, I want to ask you a bit more about education and training, because Joseph mentioned that as well. And I could see that when Joseph mentioned it, everybody suddenly pulled their phones out and were Googling the Be Well project, looking for it online, looking to follow it on social media and on LinkedIn. I can see you're reaching for your phones now and doing that. So keep going, don't worry, we understand you're looking for the Be Well project on upskilling and reskilling the healthcare workforce on green and digital skills. And Austria has been a really good partner in that as well. So that's one key component. Do you see any link between the green and the digital skills? Like, is your training seeing them as being two linked things together, or are green skills and sustainability just a separate training initiative at this point?
There are 10 modules, yes, and it's really interconnected.
Yeah.
Yes, and this is the quality of the course, and the teachers are experts in Austria in this field, and I think we had really 2 weeks ago a great start, yes, and we are very optimistic because the big goal is just the anchoring the sustainable climate protection way, also that it is possible for the next years, for the next 10 years, for the next 20 years.
Brilliant, great. Thank you for that great work and that great leadership. And remember, I'm going to come back to you with some more questions about some of the leadership role of Austria. Before I do that, Aki, I want to come back to you for some more practical guidance. We've heard about the upskilling and reskilling of the workforce. We need them to have the skills of the future. So what about organizational and workflow challenges, as well as engaging with the workforce who are currently under a lot of stress and getting them to engage with us about sustainability? What contribution could that play?
Well, in our experience in Heart Hospital, we have roughly 1,000 employees in 6 sites. And then there's a really common ways of working. So, of course, nothing will change by itself. So, but I see that it's really critical and crucial to get the people involved with this trip. And our experience is that sustainability resonates pretty well with the employees and people. So there's quite a little resistance in recycling and sorting and in these themes. I think it seems to us that at least in Finland and in our organization that people have kind of awaited when does it come to hospitals. Because we are, the healthcare is a really big polluter. So if it would be a state, it would be the 5th largest state in the world. And we use a lot of consumables. And the waste itself. To make an example, if we have, for example, in Heart Hospital, in cath lab, if we do a coronary procedure, it's quite routine, under 1 hour. We spend 20 kilo CO2 on supplies. 1 kilo for the energy and the equipment side, and almost 10 kilos CO2 in waste. So I think the people can't really affect on not that much on the supply side. I think the management, the procurement, and how we steer that. But then the waste and the sorting and the recycling, so there is big opportunities. But then also we need to get the whole chain. If we sort everything, so it should be, it should go right in the end of the whole chain. But there is good possibilities. And then also, I think the digital services, it's a really good. I think in Finland we speak about carbon handprint actually. And we mean that when there's the handprint, it means that we change things in a way that it's, there's a lighter carbon footprint. So for example, we have 8,000 patients in pacemaker remote follow-up. So there's a carbon handprint on us so that the patient doesn't travel on hospitals all the time. Or then we have done the coronary patients digital care pathway. No control visits inside anymore. So it's green. So and I think people also resonate pretty well on these themes.
So that's encouraging to hear that, Aki, that the appetite's there, the desire is there, and so we've got a lot of opportunity then to feed these things in. So let me come back to you, Jan-Willem. We heard about the cycle of products. Aki referred to that pretty well, the end-to-end system, product design, the innovations, even refurbishment and waste management. So then how do we do that better? What investment is needed in health systems in order to do that better?
I think it's the collaboration and the understanding. I said that a lot of the carbon foot reduction, I think my gut feeling tells me certain things are better for the environment, but I'm not sure that we have the knowledge to actually get us there. I'd want to start with the product design. So as a company, Philips, we make cut labs, for example, the ones you just talked about for non-invasive treatment. Of course, it's our responsibility to make sure that that cut lab can be refurbished, that it's eco-designed, that it doesn't use dangerous materials, and that's all our responsibility. Tampere doesn't need to worry about that. They can ask us questions about it, but it's our responsibility. And the NHS, for example, in the UK has told us so. It's your responsibility. Reduce the carbon footprint of your product, take it back after it's used, refurbish it if you like, or if you can, and then do your thing. But then if you put the cut lab in the operating theater, we will specify that you need positive air pressure and you need to have certain conditions for the room before you can actually install it. But we know that positive air pressure is one of the biggest energy guzzlers in the hospital. So are our engineers actually conscious of the fact that we're asking the hospital to install positive air pressure all the time? Maybe we could switch it off at night or in between. And non-invasive doesn't need that much positive air pressure. So there's things that we need to be doing together. Stuff that we don't really know that we have an impact on, but it does have an impact on your carbon footprint. And then the next thing is, if we would be able to get a patient in to diagnose and treat in the same surgery procedure in cut lab, they don't need to come back. We've done just half the carbon footprint by 50%, half it, just by changing the diagnosis and treatment. If you move further, and if you're really system-wide thinking, and that's Joseph's department, if we would have prevented this person who needed to have their arteries opened up again because they didn't have their health and their eating patterns and their life changes, the secondary prevention instructions followed, and they have to come back again for surgery, then we would have halved the carbon footprint even more. But that's the system-level thinking, where we move towards prevention. So preferably, you'd want Philips to design the cut lab out of the healthcare system and move towards prevention. But that requires a complete rechange on the way we organize our health systems towards prevention. And I would argue, so that's a nice one for policymakers to think about, if we can calculate the cost of a care pathway in terms of money, can we calculate the cost of a care pathway in terms of carbon footprint? Can we say a carbon footprint of a diabetes patient that comes back every 6 months to open their arteries is so much, and therefore we're going to have almost tradable permits on the carbon footprint of our patient. That would be, I think, where we need to be before 2030.
Okay, so thanks for helping us understand both what industry can do, but also what we need the health system more broadly to be able to factor. Roberta, I want to come back to you now for that question on the leadership of Austria. What's needed at any other levels? Like if we look to not just national, but also European levels, thinking of engagement with the European Commission, would you have any requests for them? Is there anything more that the Commission can be doing to show us leadership examples or coordination?
Yes, it's really an important topic. We heard it, the climate emergency is a health emergency, and this is why we need to pool and focus our knowledge across Europe. Yes, and almost every member state has lighthouse projects. In various fields of work, yes, and therefore I think the EU should promote best practice strategies and technologies for addressing global environmental challenges, yeah, through establishing centralized platforms and hubs. And I think this would be a good way to make the next important step and or facilitate the information of knowledge sharing networks and communities of practice to bring together experts, policymakers, researchers, and these people who are implementing in the healthcare facilities the actions. And all the people should be from different sectors.
Okay, thanks for those comments, Roberta. So what I'm hearing from you is we need more coordination, but we also need more standards across Europe, so we're all working in the same direction from your earlier comments. I wonder also, maybe a provocation, if we need this coordination from the Commission, are we looking for something like a named champion of net zero and healthcare systems? Do we need a more titled, more structured leadership there, or is it enough to just absorb it in the existing systems that we have?
I think the member states should fulfilling the promises they do, because there are a lot of, I think so, strategies, and to make the next step for funding, investment, yes, and action. This is the necessary action area we have to do.
Okay, thank you very much. Joseph, I'll come to you as the last comment, and then we've already had a lot of questions online, and I trust there's more in the audience. So, Joseph, what more can be done?
Good question.
That's me giving you the open floor, because I know you have a bunch of comments following from your previous. I'm thinking about incentives, I'm thinking about the role of policy drivers, of service design.
Yes, exactly, yes. It's funny because as I was preparing myself from the health systems perspective, and the Observer were very interested on that impact, I was looking at the literature, Michelle, my colleague, was helping me. And it's almost too easy to say it, almost too basic. It's actually most policies in health systems design, organization, finance, that are good for the health system, actually are good for the environment. Primary health care, moving care outside the hospital. It's very, very clear a case. The more closest to the community, the lower the footprint. By the way, I love your idea, John William. The same way that these days sort of I get my CO2 impact when I travel by plane and makes me change my behavior, I think to have the pathways and look at the carbon footprint will be absolutely brilliant. Maybe it's where the European Union could help with setting standards. It would be really interesting. I mean, this nudging element, we are not making enough of this nudging element, I think, and that would be very useful. So PHC, community involvement, all this move as well towards social prescriptions, community participation, engagement. Again, there's so much we can do with this idea of social prescriptions, which some health systems do not finance. It's easy for a health system to finance a pharmaceutical or a gadget, and we need the gadgets, by the way, Philip, so I think they're important when they're cost effective, so don't get me wrong. But there are alternative social prescriptions which actually would be good for the environment, and they are more cost effective in some instances. Pharmaceutical prescriptions, as we're talking, some statistics tell us that 50% of what we prescribe to our patients is never used. First is overconsumption and stockpiling. You go to the houses and you see stockpiling of pharmaceuticals. Why the Netherlands is the best in Europe, by the way, my wife is Dutch and I can never get an antibiotic there. But you're very good. You're very good for the environment because you are the best prescribers, you doctors. That's great for the environment. We should add that argument. We should together work on an index of carbon footprint of pharmaceutical prescription and also adherence to pharmaceuticals and so on, and the role of community pharmacies as well, and pharmacists. Telehealth and remote consultation has been said a lot. And what about I've been looking at that as well, the regulatory and the financial incentives. I mean, that's the way to go. How did you manage to convince your Minister of Finance to give you money? Because Aki is very nice here. Aki, I talk to many of your CEOs colleagues and they say, well, you know, I prefer to use plastics. I mean, it's too expensive, these new things that they're selling us. We need to make the financial case that actually is value for money, that renewable energy is value for money. Subsidies. A hospital in Catalonia, Mutua is doing a very good job in that area, like sort of they have sort of renewable, they bought a renewable field of solar panels, they're doing all these isolations, but also incentives to the workers to take public transport. What about giving vouchers to the patients to take public transport? Because the point is less that carbon footprint of these patients and health workforce, but as an example, you know, as a light, as a guidance, best practice. I mean, we learned so much, you're an expert on that, George, about the role of the hospitals in the community, in the areas of economic productivity, best practices with health workforce. Best practice in a hospital, we've seen that they spread, transfer innovation to other businesses. I think in this area, it's worth, Mr. Fine is very smart to invest in these hospitals' primary care because they have this spreading effect. So regulation is regulation. Can we impose regulation without incentives? I'm surprised, I keep looking at that, I don't understand. Why only so few of you have voted for lack of funding for infrastructure, research, development, and capacity building? I think that's what we need. We need funding at the first stage. Anyway, I can come back to that later after the questions.
Okay, thanks, Joseph. The other thing that your comment has me thinking about is smart design, and if we want patients to be using using their prescriptions more effectively and to not be stockpiling, how are we designing systems for that? So you talk about vouchers for encouraging the workforce to be taking public transport. That's great. There's a service redesign or thinking redesign, but people are stockpiling because they're nervous, they're scared. Accessing healthcare is hard because there's limited appointments. They stockpile because they get their treatment when they can get it, and they want to keep it in case they need it when they can't see a doctor or a nurse. So designing services to make access to what we need at a time when we need it would probably help us in those things, but it needs new thinking. But let's hear from your thinking now. So we've got another Slido coming up, and that's going to ask you about what are some practical steps, I believe is the question. It'll come up on the screen in a moment. What is the most important action to take to achieve sustainability in healthcare inspired by the, I forget the acronym, the Partnership on Health System Sustainability and Resilience. So they have some recommendations which are laid out there. Which ones do you think is the most important? Think about that, start answering it, and Hannah, you will help me with the questions. So while people are filling that in, let's start with the questions because we have quite a few. Can I have a microphone from here, please? Thanks, Joseph. Here you go.
Apologies. So I think the questions broadly come from, we had quite a lot of them from a couple of main categories. One is the role of the individual. Is it mainly, like, how do we get buy-in from the healthcare workers and make sure that they receive the skills and training, but also the question of what role the patients play in decarbonizing healthcare systems. Then the need to adapt procurement rules and how that can best be done. What EU action is needed in this area, and quite a few questions on the trade-offs. So we just had the panel on healthcare in crisis before. What kind of trade-offs are linked to systems thinking? What conflicts do we have between health system design and the ecological objectives? And then there was also a question on the fact that the ways hospitals are managed is too inflexible and how that can be adapted to make them embrace climate neutrality more.
Okay, so that was a lot of questions. Could you give us another very quick run through of just the key themes of each of those questions?
So one is the role of the individual, especially the workers and the patients, adapting the procurements, and then the trade-offs linked to this.
Okay, great. And we'll also have questions from the audience. So are you going to help me with those, or do we have somebody? If you can make sure you say your name and where you're from.
Thanks for remembering. Šarūnas from Lithuania. I'm a patient advocate. I won't bother you with questions of two. I'll give two examples that we see. So one is related to what you said, the hospitals worry about the CO2 impact. but think of all of the disinfection of all of the biocides used in the hospitals and during the COVID time. And you know, depending on the immunosuppression, etc., it might be a health life thing, and it is harmful for environment. Now, we as a patients in civil society, we speak with other civil society organizations and other startups. And during the COVID time, we found a different solution to disinfect hospitals in a way which is very sustainable. And now there's a number of different technologies. So not only chemicals could kill the things that we need to kill, right? So COVID passed, some hospitals implemented it. It was a good story. It was not more expensive than the disinfectants being used. It was no uptake in the healthcare system. So it was only win-win scenario in there, but it was not implemented, okay. So another example, we speak about carbon neutrality, but not, the CO2 itself is not killing us, but there are other things coming from the emissions of cars and factories are killing us. So specifically nitrogen dioxide, sulfur dioxide, those are the things that we hear in the spring in the news, don't go outside, snow is melting, it's very dangerous. So with that, the equivalent, and that is a direct threat to our health, asthmas, lung cancers, and all of that. Are we putting emphasis on actually not just capturing CO2, but negating those technologies? Again, an example. In civil society, speaking with other NGOs, we identified a startup which has a technology where you coat any surface externally and it reduces this type of heavy gases out of the system. Very clear thing. Then we will also try to have this community engagement, speaking with municipality as a communities. Look, where are these technologies? Can we do something together? And this is the part where we miss the synergy. Because where you have as a problem, you see in healthcare system we can do this. But they say, no, it's European Green Deal, speak with them. You go to European Green Deal and you say, look, this technology worked in hospitals. Oh, it's hospitals, it's healthcare, you need to speak with them. And then you're being bounced forth and back. And so while dealing with the big issues, right, there are a lot of good cases like this. I don't assume I know many of them, but these are things on the ground which are not getting connected. Now there was a good topic about the more coordination that you said. So we have European Green Deal, you have a cancer mission, you have a separate commissions, and these, I lack the overlap. Where are the synergies between this? There's a lot of money in there being given to industry, to the ministries, to civil society, but we are still thinking in silos. And this should be, I think, the low-hanging fruit.
Thank you for your great contributions. It's really wonderful to have the patient voice. Thank you for sharing that with us. A lot of the comments that you've raised, and Hannah, thanks for those great summaries of the question online. They touch on a lot of the things that we've already discussed, and we could maybe expand on them further. In just a moment, I'm going to come back to the speakers, and if there's one that stood out to you, feel free to elaborate on that when I come to you, or if you want me to provoke you a bit, I have some notes on that. Are there any other questions of people in the room at this point?
Hi, I'm Scott Greer from the Observatory and the University of Michigan, and I worked with Josep on the Health for All policies. And I want to argue.
Okay, go for it.
Because the answer to that is yes. Because the characteristic of this issue is that the main enemy is bureaucratic inertia, as you just said. Bureaucratic inertia is a great problem. Budgeting mechanisms are a great problem. If we were in transportation, we would be saying, let's destroy an enormous and rich industry. In healthcare, we're saying, let's try and persuade the purchasing manager to buy less plastic. That's a great problem, and that's why I'm so happy. I'm a political scientist. Most of my life is spent telling you can't have nice things. I study politics. What's good about this, about the agenda of making health something that works for a lot of sectors, is you have so much scope for creativity, so much scope for win-win solutions, because win-win solutions are what works. Taking things away from people hurts. Creating things where your interests coincide and you can do something together, and I think that's a lot of especially what I heard from Austria, that's what works. People like nice things, and we can do a lot of it.
So you said you wanted to argue. It sounds like you want to provoke.
I want to argue with your slide, and I want to argue with the 42% of you who said we need more data and mechanisms. We don't need life cycle analysis. There's a reason industry loves it.
And so we're talking about trade-offs that win-win. The last comment, invest in alternatives. There doesn't seem to be any interest in that. And so
I think it's a great idea, along with the other four.
Good.
The answer is yes.
Tick, tick, tick.
We can all do something.
Okay. Thank you very much, Scott, for your contribution and for being here. Any other comments from the floor? Okay, so keep thinking of those. I'm going to come back to the speakers and I'll keep my eye out on you. So speakers, did anybody want to jump in first? Yes, Jan Willem.
Yeah, I wanted to respond to the patient. So the whole point of the PHSSR is, with the London School of Economics, is that we try to assess a healthcare system at the country level, and we've done it for 28 countries, to understand, okay, is the health system resilient? Is it sustainable, financially sustainable, and is it environmentally sustainable? And all of those things intersect. And then trying to narrow that down to, okay, how does the governance have to change to actually improve on the resilience or the sustainability? How does the financial model have to change? How does the service delivery, technology, workforce, data, population management? Because all of that, to your point, intersects. And if we start to understand that, you will see, our friend from Michigan said, most of the things, when you start to intervene in one area, let's make healthcare cheaper or better, they all point the same direction. There's no conflict in making the healthcare system, to Joseph's point, environmentally friendlier, better, patient-friendlier, and cheaper. So we need to have more understanding. So Kyriakides was saying that we need more resilient and sustainable healthcare system. Well, go measure it, and then tell us what are the levers that are going to get us there. And I think you need probably a chief resilience officer or something of the health systems to actually have that model. Because when we started to measure this during COVID to see are our health systems resilient, there was actually no methodology. OECD didn't have it, WHO didn't have it. So that's why we asked the London School of Economics, develop this. How do we measure the resilience? How do we measure it in financial, sustainability, environmental, patient measures? Now we have that model. Let's use that, and then you'll see the investments are moving in the same direction. In terms of best practices, what we've also seen is that hospitals, you don't necessarily want to talk hospital to hospital, but we've seen that radiologists amongst themselves, they want to talk, because they are in the same situation. So what do you do? How do you make this carbon neutral? You see that the facility manager, the labs manager, the ICU manager, they want to talk to each other and learn. And there are differences. I was in China talking to 37,000 hospitals. Most of them are Western style, but they also have traditional Chinese medicine. And the leader of all the traditional Chinese medicine hospitals was saying, well, we are reducing the carbon footprint of our health system as well. But they use a lot of vapor and stuff like that, which, so then they have a lot of air pollution in the hospital. And the other thing which we can learn from is that, well, one of the biggest environmental impacts on our patients is noise. We want a peaceful, quiet hospital because that's better for the patient. And so what an innovative way of looking at environmental impact and sustainability. So there's this cross-learning that we can do between experts, but also health systems. And that is indeed motivating. It's fun, it's exciting, and we've seen a lot of people saying, I want to be part of that, because to your point, it's not taking things away, but it's actually improving things on all fronts.
Okay, thank you very much. Is there anything else on procurement, though, that you'd want to say? Because procurement came up as one of the themes in the online questions.
Buy green. So what we've seen is the EU criteria on green public procurement are outdated. Yeah, so it's to the extent of don't put poison in your products. Okay, yeah, we didn't do that for the last decades. Can we be more innovative in our green public procurement? Can we actually acknowledge the role of AI and digitization? Can we acknowledge the role of circular models? They are not in there. Can we acknowledge the role of reporting? To your point, any company that is over 250 employees should be thinking about their performance, their sustainability performance. And those criteria are easily updated and upgraded, and that will empower green procurement organizations around Europe to actually become practically, they can overnight can improve the way they procure health solutions, and also because they want to embed green criteria, but these are people that buy like everything from pharmaceuticals to CT scanners to PPE to cars for ambulances. You can't expect them to know exactly what green criteria to introduce for what commodities and what products. But they are there, we can help them define them, and I think that is a low-hanging fruit.
We're hearing two things from you then. So one is improve procurement criteria by upgrading the value of the carbon footprint and the net zero attempts of the product, but also considering it within the context overall, the broader design of the hospital, the broader system and how that's designed, because that impacts on how different products, technologies, treatments are used. From the rest of the panel, were there any of the points stand out to you, or would you like me to provoke you on one? Roberta.
The question after the role of the individual, yes, the healthcare workers, yes. they are key players. Yes, they know the situation, they know the processes, but they need a good framework condition that it is possible to act climate and environmental friendly. That's the point.
So, okay, but we're also hearing from Jan about, from Jan Willem around new positions like a director of resilience, I think you were saying. We're hearing about new jobs that we've learned in the Be Well project of things like a director of data, a director of innovations, a lot of new jobs. Do we have the resources for these jobs? Joseph, can I come to you around what are the trade-offs we're making in order to achieve these great new leaderships, these great new initiatives?
Yeah. Well, you see, I think my colleague Scott said something I wanted to say as well. I think it's one of the few areas that we can have the cake and eat it. I do believe that the question of trade-offs applies less in this area. Of course, it costs money to employ these individuals, but the return, not only on the environment, well-being, but also on the hospital itself, can be very, very high. We need best practices. I think the PHSSR has been the way forward. We are having as well an HSPA resilience model aligned with theirs. And I think it's one of the areas that the trade-offs are not as much there. Secondly, it's not, although we're doing that together or with you or for you about the Be Well and the green skills, I think it's integrating green skills at the school level, primary school level. It's about health literacy, it's about education of doctors and nurses, health workforce. So it's integrating all those in there. I think I keep going back to this idea of the labeling of setting up sort of benchmarking and I think there's a lot that can be done in that area, like sort of what is a green. I know it's happening already, and probably it's happening already in Finland, that you have the mark of green hospital. Imagine if the Commission would create, or it already exists perhaps, a set of indicators of that's a green hospital, could actually attract more patients, could improve its status, as this idea of the lighthouse, which attracts me. And then in the same area of benchmarking on naming and shaming, with HSPA work we're doing, we're developing a new performance assessment 2.0, and we are now going beyond the health system, and we're talking about environmental sustainability and economic sustainability and well-being. So we're trying to show beyond the health sector to other sectors how much the health sector can contribute to those areas. So I think benchmarking, labeling, communicating, showing that those best practices, I think is one of the few areas, maybe I'm naive, I'm not an expert as my colleagues here today, that we can have the cake and eat it. Cake is not a good example of diet actually, but there you are.
Okay, so Aki, what about then practically from you? Is there any of the comments that stood out for you? Because I certainly have questions for you around practically then how do we do this? We're hearing about these good practices from Finland, thank you for that great leadership, from Austria, but we're also hearing in other countries, they do not have the resources in their hospitals to invest in these new roles and new innovations. They are funded to deliver the care that they're contracted to do by their financing models, and they can only deliver that, and any money left over has to be returned. So is there any advice or inspiration you could share from what you've learned in Finland that could help other countries?
Well, I agree that it's not easy in hospitals. There's a lack of staff, financing issues almost globally in all of the hospitals and health system also. And we have a hugely increasing demand in healthcare. It's growing all the time faster than the economy. So it's not an easy case. But I believe that as persons and workers, the employees, the people who work in healthcare, I think if there is the circumstances and tools to implement, I think people are happy to take care of the environment, if we concentrate on the environment, are happy to take these things forward. But if we don't have the circumstances, the frames, the policies, if people don't know, if we don't have the transparency, how much we create CO2, how can we improve before that? So I think that's the first thing. And for example, on the poll, I think all of those things are good. So we would need to do everything. But maybe after all, it's the procurement. I think there is something we could do fastly. You know, even the packaging. We know that most of the products in healthcare are oil-based. There's the plastic, there's the hygiene requirements. The healthcare professionals won't change their ways of working. It's based on studies, so things won't change fast. But we could start from the packaging and from the logistics, for example, and make them more unite and more reasonable. If we have a heart valve with the size of a coin, it can be 2 meters, the package, when it comes to our warehouse. So I think there would be a lot to do in procurement side. And then one comment on patients. So in our opinion, I think the patients are happy with the new service models, the digital service models, remote service models. And in our latest questionnaire, 70% of the coronary patients in our coronary patient remote care program, and we take all of the patients in that program. So 70% of the patients stayed in the program. And they are elderly patients. And also in local and remote services, they are happy if you don't have to travel to the physician or to the hospital. We many times think that it's a 30-minute visit, but for the patient, it's a half a day or 1 day that they spend for that one visit.
Aki, thank you for those great examples of what we could learn from and what we're seeing happening. I'm just going to start to conclude now. As part of the conclusion, I'm going to come to the panel and ask you for one last small comment of what gives you hope, so we can end on something encouraging. What gives you hope? And as we get to that, I want to say to everyone online, thank you for your questions. We've been looking through them and we hope that you feel they've all been touched on and addressed. And to people here physically who've attended, thanks so much for being here and for your great questions. So to conclude, Jan Willem, can I start with you? What gives you hope?
Every caregiver that we meet is enthusiastic about this topic, and every innovation I see in the pipeline is able to help address their problems.
Thank you. Aki?
Well, I think the people in healthcare are highly educated and are very smart people, so if we create the circumstances and give the tools, so things will start to happen.
Actually, exactly that. I think that people are so conscious on the issue, they want to make a difference because, you know, change or die. And we are working with patients and health workforce that if you enable them a tiny bit, if you give them a bit of the instruments, the same point, sorry, the change will happen and very quickly.
Yes, many people, many young people, many healthcare facilities, and many companies are involved in the protection movement, the climate protection movement. And yes, climate protection isn't a sprint, climate protection is a marathon, and let's do it together.
And it gives me hope to have these great comments, your great engagement. Thank you to Philips and to the Partnership for Health System Sustainability and Resilience, and thanks to everyone for being here.